Happy 6-month anniversary, or is it unhappy 6-month anniversary? Report, you decide. Because 6 months ago today, President Obama signed the National Healthcare Overhaul into law. Several of the provisions kick in today. Joining us live is Republican Senator John Barrasso. He's also an orthopedic surgeon. Good evening, sir.
Great to be with you. Thanks for having me.
Oh, nice to see you. And well, looking at the viewers, or the voters, is that when this was passed, 55% liked it, or 55% were in favor of repealing it. Midsummer, 56 were in favor of repealing it, and now it's inching up. 61% don't like it. They want to repeal it. So where do we stand? What's the story on this?
We need to repeal and replace. This is a terrible bill, a terrible law. It's bad for people who are patients. It's bad for people who are providers of health care, nurses and doctors, and it's bad for people who are paying for it. The taxpayers are people who pay their own health care costs. It is awful, and we need to strangle it, tear it apart piece by piece, and as Ronald Reagan used to say, starve the beast. We need to undercut the funding.
All right, well, the stuff is just beginning to kick in, and a lot of the things look quite, I mean, people want health care. They want to be in good health. But is your objection to it on political reasons, philosophical reasons, that you don't think the government should be in people's business, or is it because you think it's too costly, or as a surgeon you think that it's just not going to help you provide better medical care?
Well, all of the above. Let's take a look at what the president promised. He said, if you like your health care, you can keep it. Now we know even the White House actuary, the people that look at this, said no, about half of all the Americans who get their insurance through work are not going to be able to keep the insurance that they have and they like.
Why?
Well, because the rules and regulations are written that you have to meet different criteria of the government. You have to put at this level or this level or this level, and a lot of people don't want all that health insurance. There's a mandate that people have to buy the product. There's a Supreme Court test. We'll get to the Supreme Court, but right now what we're finding is the president's promise has been broken. The promise on costs is broken. He said the cost would go down. Kathleen Sebelius said when this law becomes law, the cost of insurance would drop 10 or 20%. We now know that the cost of care is going to go up more because the law was passed than if nothing had been done at all.
How do we know that? I mean, because nothing's happening. Like, where is it? I tell you, I must admit, I'm a little bit confused with a lot of these numbers. I've been studying it so carefully, but now I've got to the point where too much information has come in. For instance, when I talk to the Republicans, they say that under this law that the senior members of our country will get reduced coverage. You talk to the Democrats, and they say no, it's not true. Medicare is not going to get reduced. So it's like I'm so confused by all the numbers. I don't know who to believe.
Well, the bill cuts $500 billion from our seniors who are on Medicare, and you talk about the Democrats. The president really is home alone on this one. No Democrats who are running for office are even mentioning that they voted for this. The only Democrats who are even talking about the law of Greta are Democrats who are running ads that say they voted against it. So, you know, the president is really out there by himself. We need to repeal and replace this, and a lot of that is going to be withholding funding from the Internal Revenue Service. They want $10 billion for 16,000 new agents to go and enforce this law. I think we ought to not give them the money.
In terms of, as a surgeon, is this new health care law, in your opinion, in any way inhibit the ability for you or other doctors to do quality work as much as you have in the past?
Well, absolutely. When you take a look at what the president touts as the Medicare changes, this is cutting reimbursements to hospitals and to physicians by 30% and keeping those rates that low. They're low already, taking another 30% off and holding them for 10 years. And they're taking all this money from Medicare.
So that means that the doctors aren't going to provide that service,
they're
right?
Not going to provide
because doctors can't afford,
they
can't afford to do it if they keep getting cut.
And the Congressional Budget Office even admits to that. It says, hey, a lot of hospitals and doctors are going to end up closing their doors. And they're taking this money away from our seniors on Medicare to put 16 million other people, not seniors but others, cram them into Medicaid, a program that only half of the doctors see them right now. So reform is going to begin by repealing this, and we're going to repeal it as a result of voters going to the voting booth on Election Day and speaking up, because the Democrats didn't listen to them all through the last year. The president hasn't listened to them. Democrats haven't listened to them. They're going to vote for people who have listened to them and know that we need to repeal and replace this.
Senator, thank you, sir.
Thanks, Greta.